All right, let's get things underway as we do an update on not just our COVID testing program, but our our contact tracing, as well as vaccine clinics. We have a lot to talk about today together. As always, it's a teamwork, it's team presentation here today. Many more people behind the scenes as well. And just a lot of gratitude to everyone who's made this happen. We will all be available, of course, for questions and answers at the end. Let's talk about what we're doing today. So we want to talk about vaccine clinics. We're so excited about having the pediatric vaccine available. Many of you have already gotten this underway. So just really pleased that we'll have some guest speakers with us today to talk both about our vaccine clinics as well as contact tracing and the transition away from the community tracing collaborative. So 2 guest speakers, and then I'll come back on with some updates about our testing program and some things that we've recently discussed in our FAQs. As always, we want to point out our Shaw Family Foundation resources and then discuss next steps and Q&A at the very, very end. So we want to just keep things moving, and I'm so pleased to be joined today by Eleni Katcher, Strategy Manager from the Executive Office of Health and Human Services, to speak with us about scheduling vaccine clinics. This is new information. We really want to get as many, particularly of our mobile vaccine programs up across the state where we can, and really prioritizing that support. So Eleni, if you're here with us, we'll take you off mute and spotlight you, and you'll just tell me when to advance the slides. I'll go to your very first slide.
All right, awesome. Thanks so much, Russell. Thanks everyone for having me. We are thrilled with the availability of pediatric vaccines, and some of our providers are already getting going on this. So the earlier, the better, we're thinking. So with that, we've opened up the mobile vaccination program to service this age group. We're thinking schools will be a huge part of this. So with that, please feel free to submit a request to the form, and this is the process for how to do that. Just to know, we are prioritizing clinics that will serve the 5 to 11-year-olds. We will still do our best to service other ones, but this is our top tier priority right now as it relates to schools. So you do this through the online form, and this is available on their website right there. And we'll send it around and make sure that you all have the hyperlink. So we ask that you submit at least 14 days before the desired clinic date. This allows us to match you up with the provider, allows you to advertise the clinic, get parents on board, and get a good turnout, because that's what we want. And so the way it works is once we have the request in, we'll review, match up the provider, and send you a connection email. And if you've worked with a provider before, we've had a lot of great partners on this project from the school side and the provider side. Please just note that we want to make it as easy as possible. So working with someone that you're familiar with will help that. So once you are connected, the provider will provide you with the consent forms, a scheduling platform. We've seen success with pre-registration for the kids, or at least for the high schoolers down to the middle schoolers. It just makes the process easier, streamlines it. People don't have to wait to fill in stuff, and just saves time and comfort for everybody. So you can go ahead, Russell. And then a few other notes. I just want to reiterate, 5 to 11-year-olds will be prioritized at public schools. We'll do our best to service all requests, but that's the priority that we're looking at right now. And so we do ask that clinics coordinate on a district level where possible. And if you want to do a cross district level, that works too. We're all about collaboration. Just want to do what works for your community. With that, we will bring the pediatric Pfizer vaccine and the Pfizer vaccine. So this will get all kids 5 to 17, adults, everyone that might want one. If available, the provider has the ability to bring J&J and Moderna. This depends on the provider and on vaccine availability. So I know everyone is eager for a booster and some of these doses, using some of these doses, but the priority will be on the Pfizer vaccine for the kids. And then we also want to do our best to make sure that the clinics are something that work for your community. So language translation support's available. Please just make any note of specific language needs in your request. And then we've also had some training done for these vaccination providers, making sure that they know how to administer pediatric vaccines. And so they're comfortable doing that. And of course, we invite your staff to participate to make the kids even more comfortable. And there's the website at that hyperlink. I'll make sure that it's dropped in the chat too if it's not already, so that you guys can just see what the website looks like, and it links to the form. And that's it. We're excited to work with you all and get the kids vaccinated.
Thanks, Eleni, so much. And I wonder if districts are interested in a cross-level, setting up a mobile vaccine program across districts. Would they just signify that on the form when they fill it out? How exactly would they do that?
Yeah, that's great. So there's a note section on the form. We probably only need one request between them. So just note that who this will be serving, and we'll ask any follow-up questions if we have any. But that's probably the best way to do it. Just make a note of it.
Excellent. Thanks so much. And we'll certainly give people time to think about their questions. Eleni, if you wouldn't mind sticking around so that at the end, if there are more questions about the mobile vaccine program, we'd be glad to chime in. Lauren.
Russell, I actually just have one question that came in the chat. So Eleni, if a district has already scheduled a vaccination clinic, one before this announcement, do they have to do anything differently to allow 5 to 11-year-olds to participate?
No, they don't. I think the one thing is just checking in with your provider to make sure that they are prepared and will bring that vaccine, because they kind of service it by the different populations that they're looking at. So we've worked with all our providers to make sure they have enough vaccines. That shouldn't be a barrier. It's just a matter of making sure that they know that 5 to 11s will be there.
Great.
Thanks very much. And don't hesitate to send in more questions for the end when we get to our Q&A session too. So thanks so much. Let's go now to our update around the transition of the Community Tracing Collaborative. So pleased to have Gina Ferguson with us, the Assistant Commissioner from our Massachusetts Department of Public Health. Gina, same story. I will advance your slides, and really thankful for your presence here today to give us an update on this transition.
Thank you very much for having me. I really appreciate it. And I'm really glad to be able to join you today. I know there have been a lot of questions around, the CTC, that's the Community Tracing Collaborative, and timeframes that people have been hearing about. And so I'm really glad to be able to walk through some of this with you this afternoon. So as many of you may know, the Community Tracing Collaborative, and we of course use acronyms, so as the CTC, was created really early in the pandemic in April of 2020 to respond to the surge of COVID cases that we were seeing in Massachusetts, and to assist local health departments in doing both case investigations and contact tracing. It's a collaboration between, it was really stood up by what was then the COVID-19 Command Center. And it's a collaboration of the Department of Public Health and Partners in Health. And the Health Connector is our organization that is really the contract administrator on behalf of the state. They're the same folks who do the health insurance registration. So really, when the CTC was established, it was early on in the pandemic. There was very limited testing capacity, minimal to no therapeutic interventions. But it was really kind of trial and error. It's a novel virus, as you know. Of course, no vaccines. Really today, Massachusetts, thanks to many of you and the local health departments and our other healthcare providers, we're a national leader in vaccine administration. We have a lot of free testing available. And we have the second lowest COVID hospitalization rate and case positivity rate. So this has really been a success, even though we're still in our pandemic. But we ended our public health emergency in May of this year. Give you an example of scale. We've had more than 1.1 million cases, contacts. Those have all received follow-up by local health departments and the CTC. Over 2.6 million phone calls and visits end up going to cases and contacts in order to make sure that people have information about what to do, how to isolate when they're ill, and how to quarantine when they have been exposed to somebody who is ill. So let's go ahead, if you don't mind, advancing to the next slide. So over the course of the last year in particular, we've been really fortunate in Massachusetts and to receive both state and federal resources to be able to help respond to the pandemic And we've been able to allocate a good amount of those resources, over $15 million recently, to local health departments, very specifically to build local capacity around case investigations and contact tracing. That's in addition to other monies that have been provided for just general infrastructure development, but this money really is around responding to cases and contacts of COVID. We're also preparing to issue an additional $4 million. This will help. This is like a one-time pot of money that has to be used by the end of the fiscal year, but we're going to be sending that out as well. And it's very specific around contact tracing and case investigations to continue to respond to cases through the winter. And also there are volunteer organizations and that have actually grown with us. The Academic Public Health Corps used to be the Academic Public Health Volunteer Corps. We have moved this into a different type of arrangement where we're really trying to build both a support system for municipalities and also build an opportunity for workforce development for a new public health workforce. So the Academic Public Health Corps will place volunteers and interns to help meet short-term needs, creates this, like I said, workforce development opportunity. They can also do projects. So we have hundreds of people who are part of that organization, and we're working really closely with Mass Health Officers Association to oversee that. And it's part of our Office of Local Regional Health here at the Department of Public Health. So we're very excited about this opportunity to continue to build a public health workforce and also to provide services to municipalities. And then we have ongoing technical training like these calls. We have a weekly local health call. We have MAVEN training, which is our state system where we do disease management. Many of you who are school nurses are familiar with the MAVEN system, since that's how infectious diseases are reported back to the municipalities. And we're working really hard with our CTC staff to see if we can't help find them opportunities for working in our municipalities. Many of them are very excited about the work that they've done, and so we're advertising job openings with them, basically, so they can maybe start work in our local health departments, and to have experienced job applicants, some of whom are very familiar with your municipalities, join these teams so they can continue their work with you. If you'll go to the next slide, please. So as we've built the infrastructure up, and we have also been successful in reducing cases and contacts, we are transitioning away from using the community tracing collaborative, and the local health departments and DPH will resume responsibility for case investigations and appropriate contact tracing, utilizing the schedule that you see here on the slide. The CTC is going to stop taking new case referrals at the end of November. They'll work on those cases for a few weeks. We anticipate they'll be completed by December 17th. Municipalities will still have access to their local health liaisons through the end of the calendar year, but we won't be sending over new cases or contacts to the CTC at the end of this month. I'd like to point out that the CTC will continue, at least for now, the deployment of Mass Notify, and then it'll transition to the Department of Public Health. Mass Notify is actually, for those who are less familiar with it, it's a platform on your phone. It's actually part of the Apple and Google systems that allow people to register and anonymously report positive test results to other users. It exchanges an anonymous code, and you can get a phone alert about an individual who might have been near you who is now has tested positive with COVID, and they, and if you were around them for a certain period of time, you'll get this code on your phone to direct you to information about how to appropriately monitor yourself for symptoms, and remind you how important it is to take care of yourself and to quarantine if you're a close contact. We have about 23% of the state's population currently registered with that. That's about just under 1.6 million users. We're going to continue to support and promote this electronic notification because as the CTC transition away, we think this is a really important element of our contact tracing work because it's basically an automated system that allows this to happen. So it's another part of the infrastructure support, and perhaps I should have arranged the slide a little bit differently. But we have some evidence to suggest, this actually from the UK, as many as when a population, as much of a population as 15% of that population is registered with an electronic system, it actually has a tremendous impact in preventing new exposures. And we have, like I said, almost 25% of our population currently registered and utilizing the system. So it's great, great additional supports in Massachusetts. Could you go to the next slide, please? I guess I'm done. So what I will do is I will stay on and take questions as well, Russell, if that's okay.
That's awesome, Jana. Thank you so much.
Okay.
Really appreciate you being here.
Thank you. Thank you.
Lauren, anything pressing that you see in the chat for Jana? And we can also save questions for the end.
Nope, we should move on.
All right, thanks so much. Great. So a few updates about our overall program and the testing program and some updates from our most recent FAQs, and actually one update that will be forthcoming in our FAQs. Just to start with the data. So we're so pleased to see a few important points from the data that you see on your screen right now. First of all, we just know that you're conducting a tremendous amount of tests through our test and stay program. And we know that we've literally saved more than 85,000 days of learning through test and stay. And you're just showing us the effectiveness of it, that we are just very regularly monitoring students and just knowing that if they do test positive, that we know the protocol to follow, but by and large, as they're not testing positive, and you can see this differential between the number of tests that we've conducted and the number of days saved, that low rate of transmission of anybody, any of our close contacts being identified as being positive is just really gratifying to know that we're keeping those kids in school. Those are 85,000 days that students would have been home. And we know it's more than that number of days. Also, I think it's really important to point out our positivity rate from our program. This is up through the 31st, and then the program total from the late August until now. And the state rate is right now at 1.8%. And so in our schools, it's really notable that our schools are at 0.88%. Just really, again, solidifies this idea that our schools are safe places for teaching and learning. We don't see high rates of transmission. Really appreciate the emphasis on mitigation strategies. So the work you're doing is having an impact. And again, I just want to use the data to show that it's not just my belief, it's something that pans out when we look at the data. Let's go on to a few updates though. So, I'm really careful to say that it's more than 85,000 days that we've saved of learning, particularly because we just know that we need to get all of our Binex Now data reported and registered. And we know that obviously there were some challenges at the beginning of the school year with getting all of our staffing in place and the program fully up and running. And we really appreciate your commitment to working through that. But we really want to be at a place right now where we are getting all of the results into either Crush the Curve or Project Beacon, including those historical data, those historical results that your district has not maybe yet recorded, so that we can really make sure that we are fully complying with DPH regulations regarding reporting of COVID-19 cases, that we can more accurately track our positive cases and clusters. And we really want to make sure that we know the further effectiveness of test and stay as a mechanism for supporting in-person learning. So while we feel like we have good data now, we know that with all of the results, particularly the negative results, fully into the system, we'll have even better information about the work that we're doing. So we can track and see the number. There are some districts that have received a large supply of Binex Now, but haven't reported sufficient results. And so, we will be reaching out to those districts to follow up, to, problem solve and troubleshoot. What can we do to help? Because we really want to make sure that we're getting the full results into, Crush the Curve or Project Beacon. And, this is something that all of the districts committed to by taking part in this program that's at no cost to the districts. it was also the assurance of completing this step in the process. And so we just want to make sure that we are really working hard to get all of the information in. And we want to keep our flow and our supply of Binex Now coming to you, but it's just where we see a large supply going out the door and not the full amount being recorded back into the system and requests for more tests. It just leads us to knowing that we need to reach out and just work to get this resolved together. So I appreciate your attention to this, and I'm certainly glad to answer any questions that you might have about reporting all of the Binex Now results. I know a lot of questions have come up around the expiration of Binex Now kits, and we know that a significant number of kits will expire within about the next 45 to 60 days. Right now, Abbott Labs has not issued a further extension of the expiration date, but they might. And so what we would ask you to do is just to hold on to any tests right now, and even up through the end of this calendar year, so that we can kind of just be on the lookout to see if a further extension is granted, or if we then need to give you advice on what to do with expired kits. So we're getting a lot of questions kind of anticipating expired kits. Right now, just please hold on to them. If we get more information, we'll circle back with you if an extension is granted, or if we need to tell you what to do with truly expired kits. Jeremiah, anything that you want to add about either topic about Binex Now?
Yeah, Russell, thank you. And hi, everybody. The only thing I'd add on this particular topic is I know it's frustrating to be asked to store kits that seem like they're past their expiration date or will be soon. But we did receive an indication from Abbott last week that there was a real possibility that these will be extended again. It's not a promise, but the last thing we want is to find out after we instructed you to destroy kits or throw them out that actually we could have used them to test kids and keep kids in school. So really appreciate people's patience with us and really with Abbott through us there. And actually, I'd also add one thing on the test and stay reporting. I really understand that reporting results into a software system falls very low on the long list of very urgent things that we're asking school staff to do every single day. I have a deep appreciation for that. But I would just help folks understand that this is one of really the 2 states in the country that's operationalizing this test and stay model on any kind of real scale. And there are a lot of eyes on Massachusetts and how this is going here. Not only from other states, but also from the CDC, who is currently considering something like this in terms of federal guidance. So please just help us report the most accurate results of the program here that we can. I know that everyone's got a lot going on, but I would hope that we have some responsibility to the kids in other states too, who don't have access to this right now. Just make sure that we're showing folks accurately how the program's working here in Mass. Thank you, Russell. Thank you, everybody.
Thanks, Jeremiah. Really appreciate those concluding thoughts there as well. We've actually worked to streamline the ordering process for tests and supplies. And so we're making this announcement today. It goes into effect tomorrow, but we're really pleased about a much more consolidated way for you to order the tests and supplies that you need for the program. So as you know, you previously ordered your tests and supplies using separate forms for Veritas, for Broad, for Binex Now, for eMed. You had to kind of keep track of which form to use. Now, I'm really excited to update you and let you know that we have one ordering form for all tests, for all supplies, and it's found in the school and consent database. So one-stop shopping, hopefully you or your designees are familiar with that database and would know where to go to get this. The other, I think, really great thing, very 21st century part of this, or kind of like trying to be more like the online ordering that we do in our personal lives, is that you can view the status of your order. And so just to know kind of where it is in the process, I hope we'll just add that kind of transparency, that confidence to know that your order was received, that it's being processed, that it's on its way. I know that I look for that when I order online, and we want to make sure that we're doing something very similar for you here. And then, a really important piece of this is who can order. And we've given this a lot of thought and wanted to make sure that we're assigning the right level of access to this. And certainly we're open to feedback as we go along with this new ordering process, but it's any individual with a CIC Health Portal account can gain access to this. And on the right-hand side of the screen here, you see the kind of step-by-step directions. So as Lauren puts the PowerPoint into the chat, ask you to grab it and take a look at this step-by-step guide. But we actually wanted to go one step further and provide you with a video of how to order your resources, your supports, your supplies, your tests and supplies. So you'll see, again, when you get the slides, that on the left-hand side of the screen, you have the ability to watch a video that will kind of take you through the step-by-step instructions for getting to the right place in the CIC portal in order to request your supplies, request your tests. So I won't go through those 6 steps that you see on the screen right now, but we're really pleased to offer you this much more consolidated process for ordering and much more transparent process for knowing the status of your order. Jeremiah, Lauren, anything else to add about this new process?
Nothing from me except thanks to the folks who worked on it.
Absolutely, absolutely. Just trying to grow the program and make it even better for you as we go. I want to move now and maybe make a connection to what Jana was talking about earlier about close contacts. We just want to continue to reiterate this message of the appropriate identification of close contacts, that the close contacts for test and stay really need the individuals we select for test and stay really do need to be legitimate close contacts and no one else, because we know that there's some pressure on expanding test and stay to perhaps some other individuals, or some concern that a wider group than just close contacts need to be tested. As we've talked about before, that's putting pressure on staffing, on supplies, that's perhaps unnecessary. It's putting pressure on students to have to go through the testing process if they don't need to. So just on this slide, I know you all have seen this information before. Just want to reiterate and kind of lock that definition of a close contact into our memory, so that we're just always using it like a mantra of who is a close contact. And then frankly, some of the important details about it, that when does the at-risk exposure time period begin? That's that 48 hours prior to symptom onset. Those multiple brief interactions don't kind of add up. Like those multiple brief interactions, it's a longer period, that could add up to 15 than just passing somebody in the hallway, for example. And the difference between indoors versus outdoors is also so important, that interactions that occur outdoors, whether you're masked or unmasked, do not count towards the definition of a close contact. We're not finding close contacts outside. Again, I know we've gone over this before, so just want to be brief here and really then take it to the next slide to talk about exemptions to close contact quarantine and testing protocols. So there are some individuals who are just routinely exempted from our quarantine and testing protocols, even if they're close contacts. So again, those asymptomatic, fully vaccinated close contacts should not be engaging in test and stay. In fact, must not engage in test and stay. If you are, classroom close contacts at least 3 feet apart. So if, when you're further than 3 feet apart, again, you don't need to be identified for test and stay. Individuals on the bus, as well as anyone who has had COVID within the past 90 days. We're getting reports and some concerns that there is pressure, particularly on our nursing staff, to engage more students in test and stay, particularly students who were exposed outside of school. And I know this is a difficult message to get across, but like Jeremiah said, what we have here in Massachusetts is very unique. We think very effective, but we need to make sure that, we keep it, true and implement this with fidelity. And, we feel like, again, we know that students who are exposed in school are in a much more managed environment than exposures that happen outside of school. And it's really hard to judge, the risk level that goes with outside of school exposures. So we really have to kind of draw a line and say, if there are exposures that happen outside of school, unfortunately, those students cannot engage in our test and stay program. And we would just really politely ask that we not put the pressure on a school nurse or anyone else to say, you know, hey, a student was identified as a close contact in an in an extracurricular activity outside of the school, not a school-based activity, or in the home. Can we just make an exception? Could we just let that child into the test and stay program so they don't have to miss school? You know, our hearts definitely feel that, right? We don't want to keep kids out of school. We want all kids in school, but we want kids in school safely. And we don't want to risk others by inappropriately extending test and stay to individuals who shouldn't have access to it. So we just really ask that, you know, we not put pressure on any staff members, but particularly our nurses, to allow others anyone else into the test and stay program other than those who are either should be in or are exempted from being in. And, you know, we do take this seriously, and we'll follow up as necessary if we're hearing about this becoming a pattern in any school or district in the state. But before I go on to this issue about close contacts and testing protocols, Lauren, Jeremiah, I just want to see if there's anything further you want to add there. All right, great. So a new topic for you, one that is responsive to questions that we've asked. And again, this sort of builds on what we just talked about. Are there, you know, a question that we've had a lot of is, what about the after school programs? What if a student is involved in test and stay in school, and they're told that they should quarantine outside of school? So you can come to school, you can be engaged in test and stay, but when you leave school, you need to not do out of school activities, including the before after school program. And we know that's put a lot of pressure on families. So we thought long and hard about this, and we've worked with our partners at DPH and EEC to think about this. And, you know, we know that our EEC affiliated, that's an important definition, EEC affiliated before and after school programs have protocols that are very similar to what our schools have. And so we feel like it's enough like school that this is where we want to begin to just take that one next step forward and say, you know, again, we don't want pressure to involve others in test and stay who shouldn't, but we are asking the question of how can we, you know, maybe extend the opportunity of test and stay to the same students who are already involved, but to allow it to extend into after school time programs. So we are examining this, and we have a potential of expanding to the opportunity of test and stay to out of school time programs. What this would mean, again, is the student who's identified as a close contact in school, who's engaged in test and stay, where we have consent for the student to engage in test and stay, they could go on to the after school program. They could come into the before school program and then just continue to participate in test and stay. Or if they are exposed in the out of school time program, if they're exposed in that after school program, they could participate in test and stay. We have piloted this on a very small level in the state just to see how it works. We're pleased with the results. So we feel like we're ready to examine a further expansion. The really key thing to this, though, is that it does require additional consent from parents to share information between out of school time programs and school districts. So you can imagine that someone in the school is going to have to let the out of school time program know that student A has been exposed, is participating in test and stay, and has the ability, the clearance to be able to stay in the out of school time program. And we would also need the consent from parents, right? So this is all in one consent form to allow the out of school time program to let the school know that a child was exposed in the out of school time program and can and should now engage in test and stay in the school, because the only place where test and stay is happening is in the school. We're not going to be doing testing in the out of school time programs. This is just for the students. It's not for the staff in the out of school time programs, to be clear. But as you're thinking about this and sort of asking yourself if this is the right thing for your community, for your district, the thing that I really need you to think about is that this does require going to parents, asking for consent, and having that information on file so that you can then get the green light to move ahead to have this operationalized. So we're going to hold another webinar likely next Friday on this topic about this potential development. And so in our PowerPoint here, we just have a brief survey. Literally, it's name, role, and email address so that we can then follow up with you if you're interested to say, hey, here's our special webinar next week to talk about this, to give you the information that you need to share with you that consent form, for example, walk you through the process. We'll obviously be doing the same thing. EEC will be doing the same thing with our out of school time programs to let them know about this so that we can, start this. I can imagine it sort of once we get consent, it's probably going to be, sort of an after Thanksgiving type of thing to really get this rolling. So again, if you have sort of initial questions, I'll be glad to take them at the end. But just want to, kind of maybe, there are about 350 people here now. We could imagine that a smaller number of you might be interested in this topic and wanting to come to, a webinar devoted solely to this topic next week. So feel free to fill out the survey. Again, it's really simple, and just so that we can, kind of get to the heart of this and follow up with you. One of the final topics that I have, almost final, I think 2 more to go, is answering some questions that we received and either things that, sorry. So a couple of things that we just want to mention.
Yeah, for now.
Lauren, can you?
Yeah, hold on. I'm trying to take care of this. 1 second.
Thanks so
I
much.
think I just did.
Okay, thank you.
Thanks, Jeremiah. Really appreciate it. So, last year when we started our testing program in February, if you think about it, we didn't hit a lot of very shortened weeks, right? We only hit Monday holidays when you think about February through the end of the school year. So this year, understandably, particularly for pooled testing for our routine COVID safety checks, we're getting questions about, what should happen during Thanksgiving week because it's such an unusual week for us. And the way that we thought about it is, pooled testing is a whole system. It's not just the collection of the samples, it's processing the samples, getting the results, and if you have a positive pool, following up with the individuals. So we don't want to start the process, for example, on Tuesday or Wednesday of Thanksgiving week, if we can't really finish it, right? If we're not ready to finish the process on Thursday and Friday, we want to be very mindful of that. And so what we ask you to do is just, work with your project coordinator and think about a schedule that's going to work for your community, for your school community, and that can be supported by the staff during that shorter week. So it might not be, it's likely not possible to, if you test on multiple days during the week, to move everybody over to Monday, right? Because on Monday, you would conceivably get the results back on Wednesday, but Wednesday's a half day. So how's that going to look? How's that going to work? Are you going to have the staff to be able to follow up if you get positive pools back on Wednesday? If you test on Tuesday, you're going to get results back on Thursday. While we definitely want to make sure that we are ensuring, safety, obviously across the board, that's our number one concern. We just know that safety comes by being able to run a full process. And so we just ask you to be thinking, if you're doing pool testing, just think now and talk to your project coordinator now about what Thanksgiving week is going to look like and what's doable in your local context. Lauren, Jeremiah, before I move on, I know we've talked a lot about Thanksgiving week. Anything more to add there?
This is a new FAQ that will actually be also posted in our Commissioner's Weekly Update on Monday, but we wanted to make sure with this webinar here that we were also providing the information directly to you now.
Great. Thanks, Lauren. And then final slide. I did this one myself. So proud to say, and usually my team says to me, Russell, why do you pick these images? It's a trial balloon. So if you're not getting it, this is the idea of a trial balloon that even if you're running our testing program now and you're going to switch testing modalities, we would ask that first week that you are going to switch into a new modality, like if you're going from single swab to double swab testing, and it's new, it's mid-year, we still want you to go back and think about it as a launch week, as a trial balloon week, where you're going to work through the kinks, you're going to work out any of the issues that come up. And so, and then think about, like, we're going to fully launch the next week. because we've definitely seen some hiccups along the way where districts have, thought, hey, I'm doing testing, and the vendors too, right? Like everybody involved, the staffing agency, the district certainly has and should have confidence in their ability to test because they're doing it now. But I also want them to have confidence and some ability to kind of like give themselves some breathing room as they shift to a new modality. Think about, that first week being a launch week, and communicate that like, hey, we're shifting modalities. It's going to be there could be some hiccups along the way so that, next week we're going to grow together. And then the week after that, really be ready for what we'll call a full implementation. So I hope that helps, maybe in your messaging. We want to encourage you to adapt our program. And if you need a different modality, please, make that shift, make this program work for you. But do it with the mindset that you're going to need to kind of have a little trial balloon phase here as we go along. So as we just wrap up real quick and get to your questions, we're just always pleased with our support from the Shaw Family Foundation. And I know I've shown this slide to you before, but just where to go to get cheat sheet information about the various software platforms, the links to the software platforms themselves, just to make that easy for you, and the kind of summary information about how to keep track of key information for each of the 3 programs that you see listed here. So much gratitude to our colleagues there at the Shaw Foundation. Also gratitude to the Shaw Family Foundation for their work on the Open and Safe Schools website, which is actually a national website that's available. And it has a lot of the same resources on it that's on our COVID-19 schools website that is just for our Massachusetts model or Massachusetts program. But the Open and Safe Schools website could be a good resource just to look at on a national level for testing programs, where there are great things like communication plans, additional FAQs, webinars, and peer-to-peer resource sharing. So feel free to take a look there. And again, our gratitude to the support that we're getting to just bring good consolidated information to you to help you with the facilitation of our program. Finally, just in terms of next steps, again, a slide I've shown you before, but just in case, a reminder helps, where to go to get information on our website. So our COVID testing program, including the recording of this session, will be available on our COVID testing webpage. Our on the desktop page includes where we put out information, for example, about the vaccine clinics, the letter to families. If you're needing that, it's translated, it's available in our on the desktop page. And then, like Lauren said, our general FAQs that usually we try to line up with the Commissioner's Weekly Update. We release them on Mondays. We have a web page just for our FAQs, and would always ask you to take a look there. We've talked about this before, about where to go to get help. Your project coordinator, first and foremost. If there's any further questions there, you can always go right to CIC. CIC is really added on to their support team tremendously. You're getting right back to people. Their email turnaround time is really very, very fast, and I appreciate their work there. And then, also, that here at DESE, Lauren and team oversee our K-12 COVID-19 testing email address, and always the support that we get from the Shaw Foundation at COVID Ed testing. So I'm glad to just wrap up right now and Lauren, see what questions there are in the chat, and hopefully provide more information to our very respected guests here.
Great. So we actually did have 2 questions for the vaccination clinics. So Lainey, this one's for you. Wondering what private schools, how they're able to participate in the vaccination clinics.
Thanks, Lauren. So private schools can of course still participate in the vaccination clinics, submit requests. It's just that when they come in, we'll kind of tier them in priority. So there's no, there's really no guarantee for any school, but we'll do our best to meet all needs, including those of private schools. So it's just a matter of place in the queue.
Great, thank you. And then a question about what documentation is required for families or for students when they come to the clinic.
That's a great question. So some providers have a their own particular consent form, but the state also has our own, which is available online. And I'll make sure that's thrown in the chat. It's pretty standard. It's just been the same one. We just adapted the 12 to 17 to add the 5 to 11s to that. So it's something that you all should be familiar with. But I'll make sure that you guys can take another look at that.
Great.
Oh, Lainey, sorry, just to be clear, families don't have to, like a 5-year-old will not need documentation in hand. We would just need the information required to send to Maven.
Yeah, they just need to consent to the vaccine, pretty much. No insurance, no ID, nothing like that.
Great, thanks. So Russell, lots of questions about the EEC affiliated out of school time programs. Wondering if this is going to be required for participation, and wondering if this now means that contact tracing will be able to be extended to home-based contacts. So 2 questions there.
Yeah, so this is definitely optional. It is not required. And we want to make sure that, any district that signs up for this is doing this obviously in close conjunction with the out of school time programs who serve your students. And we want to make sure it feels right for everyone. So everyone involved. So definitely not mandatory. We're just trying to, safely expand the role of test and stay to really, answer questions that we received from you, from parents about, hey, what about these out of school time programs where they follow such similar guidelines? The other thing, Lorna, that we're, this is really then within the confines of exposures in the school and exposures in out of school time programs that follow very, very similar guidelines as our schools do. And it wouldn't then extend right now beyond that whatsoever. So nothing about exposures in the home. That would be included really just in exposures in the school or in the out of school time programs. So hopefully it wouldn't also then require more emphasis on contact tracing into the home or beyond.
Great. So then there's a lot of questions about the testing that is going to be required, or if any guidance will be provided about testing before and after the holiday break. So will we require mass testing, for example, for students, or will there be guidance around that?
So certainly something that we have been talking about. I don't anticipate that we will, though, say that it's a good idea or necessary to do mass testing. We hope that you are running your pooled testing programs. We think that it's sort of like a steady on type of thing, like let's just keep going with the surveillance testing that pooled testing offers. It's never too late to shift into pooled testing if you think that's appropriate. But we are not endorsing our state resources to be used for individual PCR testing for every child after the holidays, for example. Jeremiah, anything more that you want to add there?
Nope, that's exactly right.
Great. So related, there's a question if a student is currently participating in test and stay during the shortened week, what happens when they reach Thanksgiving? How do they continue test and stay?
Yeah, and Lauren, feel free to chime in here, but my thinking on this is that it's just like a weekend, but it happens to just be a longer weekend. That let's just say they're doing test and stay on Tuesday and Wednesday. They start days 1 and 2, Tuesday and Wednesday of Thanksgiving week, and then there's no testing that goes on Wednesday, Thursday, Friday, Saturday, Sunday. When they come back to school on Monday, wherever they are in the process, if they've hit that 7th day during the long weekend, they need to be tested when they come back in on Monday. So there's no testing that needs to happen when they're not in school, but when they do come back, even if they've already hit day 7, even if they've already gone to day 8, doesn't matter, whatever day they've hit, we want to make sure we still test them when they come back in. Lauren, anything further to add about that?
Yeah, the only other thing I would add is that if a student is participating in a school-sponsored event over that long break, they could be sent home with eMed tests in order to test before that school-sponsored activity.
And we would just want you to plan for that by having eMed on hand then.
Great. So we actually didn't get too many other questions. That's sort of the extent of it.
Great. So thanks for funneling your questions to Lauren. We always take a look at them afterwards too to see if there's anything else we need to add, update for our FAQ. And, as we get closer to the holidays, I just want to say thank you to all of you for your hard work. I hope you'll have some time off, particularly over Thanksgiving weekend this month. And we'll look forward to seeing some of you next week when we do a follow-up on the out of school time programs. Thank you to our guests today, both Eleni and Jana, for your time today. So very much appreciate your willingness to be here with us. So on behalf of all of our team, our COVID testing team, we look forward to seeing you again soon. And thanks so much for your time. Take good care.